Everybody, we will start to get underway here. We've got about 77 now on the call. My name is Eric Duncan, Member of Parliament. You're probably sick of seeing me by Zoom over the course of the last, I think, 9 weeks or about 2 months now. But this we found has been a very good way of communicating to our business community and to our local stakeholders some of the updates of things that we're working on, some updates we've got, and then also getting some feedback from you. So we're pleased to host today's session. The conversation has certainly been more uplifting the last couple of weeks, as specifically our province leadership has started to relax some of the essential business lists and get the first phase, it looks like, of businesses reopening. And one of the things that Jim and I wanted to do by hosting this today is to continue the communication. We may not have all the answers, but we'll try to get them from the people that do and their expertise. And start to plan for our business community to be ready when your phase comes up and when you're able to reopen in whatever form it may be, is just starting to think now of what types of things your businesses will need and to share some best practices and tips on that end. I had an email from a local business owner I've been in touch with, and they are in the retail sector, let's say hardware and that aspect. And they opened up to the public again in terms of going into the building. Limited number of people, directional arrows, sanitizers, social distancing. And he just sent me a note to kind of share not the most positive experience that they've had overall. Most people are obeying and respectful of social distancing, but their feedback is that they've got in the first few days of being reopened again that several members of the public just don't seem to get the stand back and keep a distance, where they're coming right up to staff and asking questions that way. And even unfortunately, they I won't be too depressing, but they had to call the police on somebody, for heaven's sakes, to escort them because they were upset about the social distancing rules, which I hope is not the norm. I think people are ready to get back opened and they know that we're all in this together. So again, what we want to do today is get you some information and share some best practices so you can be ready when the time comes for your business. I'm just going to pass over to Adrian for a second. He has become an expert on this. He's probably on autopilot when it comes to this line, but just about how you can ask questions throughout this as we get going. So Adrian, can you go over those details, please?
Sure, absolutely. Welcome, everybody. I've seen a lot of familiar faces as well, so I'm sure most of you have heard this little spiel as well. If you are interested in asking a question during the session today, what I would ask you to do is not to use the chat feature, but to go down to the little tab, if you're on a desktop or on your iPad, participants. If you click on that, it'll then give you the option to raise your hand. So if you raise your hand, it'll notify me. I'll be able to unmute your mic and allow you to ask your questions. People are emailing in questions as well, and they have earlier yesterday and earlier this morning. You can still go that route if you would like. You can send an email to eric.duncan@parl.gc.ca. And I'll have my phone with me right here so I can actually see your questions come in live time that way. If you are calling in from a phone or a landline or cell phone and you'd like to ask a question, you just hit *9, and then that will again give me the notification that you'd like to ask a question, and we can unmute your mic. So that's the spiel. Turn it back to you, Eric.
And I'll pass it over to Jim, our member of provincial parliament. Jim's the one that takes the calls these days on the reopening lists and those types of things. I'll pass it over to him to give a general update of what's been happening there at the provincial level and some things that he's been hearing.
Well, thanks, Eric, and thanks everybody for joining today. We're starting, I think everybody heard the comments this week from the Premier that we'll be opening a number of businesses. The announcement tomorrow. We opened up a lot of retail stores and hardware stores, nurseries over the weekend and more on Monday. And we're going to be entering phase 1 or step 1, which will be a limited number of stores, giving us time to evaluate the impact on the health system. If it's positive, then we'll move on through phase 1 into phase 2, and then on to phase 3, which is back to normal or near normal. And over the phase 1 period, when we enter that, we'll be also conducting a number of calls with different sectors to see get their feedback and provide it on to our command table that our open to business table that our province has set up with about 7 or 8 of the cabinet ministers and other industry experts, along with their medical officer of health that are really looking at how best to move ahead through this whole scenario. So again, wanted to thank you, and we'll be taking this feedback today. And Dr. Paul has been great to work through with different operators to give them advice how they can open on-site visits. Really all about trying to contain this virus and moving ahead to the next phase. So thank you again, and I'll turn it back to you, Eric. I'm not sure if Dr. Paul's back or.
He is just signing in here now, I believe. I just saw his name come along. So Adrian will unmute him here shortly. Just a couple things while we're waiting for Dr. Paul to get signed in. Adrian's going to be sending a follow-up email when we get done the presentation today. And there's a couple of things that will be included in it. I want to give a plug. Hopefully you'll get some good information from this session today. But the Cornwall Chamber of Commerce is hosting a session tomorrow morning online between 9 a.m. and 10:30 a.m. And that's entitled Getting Your Business Ready for Curbside Pickup. So similar to today, we may be covering some of that, but there'll be, that is open to anybody. We'll send you the registration link if you're going to be doing a curbside service and want to partake in that. By all means, the Cornwall Chamber does welcome you to that. Another thing I want to promote as well is that Leslie Thompson is on the call from the Community Futures Development Corporation. Leslie and my office and her office have partnered together, and we're going to be doing a seminar together later this week on 2 new programs that they have available to help local businesses. You will get those details in the email this afternoon. You're welcome to join that webinar. We're hoping for Friday afternoon, final confirmation to come, but it's going to cover 2 programs. The Technology Innovation Fund that they have, which is working with different businesses and giving grants and connecting them with tech resources to add technology to the business offerings that they have. That's going to be the first part of the seminar. The second one is going to be focused on a program that I hope is going to be helping people who have fallen through the cracks on some of the business loan programs. The CEBA, the $40,000 loan. And what they've got now is the CFTC is going to be running a Regional Relief and Recovery Fund. If there aren't enough acronyms, RRRF Fund. And that's basically going to be the CEBA program, $40,000 loan, an interest-free component, and you're able to keep $10,000 of that if you pay it back by the end of 2022. The advantage or the opportunity the CFTC has is more flexibility for the businesses. So if you're a sole proprietor, if you are paid by dividends and don't have that payroll component, if you've already actually got the $40,000 and it's not enough for the size of your business, that's an opportunity as well. But we're really hoping that those that have, I say, fallen through the cracks will be eligible for this. And the CFTC can take a look at your financial history, your setup, and be able to help more businesses. So that webinar likely to come later this week to cover those 2 programs, and we'll encourage you to participate in them if you're available. And now, Adrian, do we have Dr. Paul on here? I believe we saw him come on here. Is he unmuted there?
Yeah, I think I'm unmuted.
Hello, Dr. Paul. Good to
I
see you.
apologize for being late. I was with the Chief Medical Officer of Health on the phone talking about some upcoming announcements tomorrow.
Good. So actually, which is a good segue. So on this call, and Adrian was mentioning this, and as we were in the waiting room to begin the call with Jim and I, we've got a lot of questions about when can my business open? And I understand that is a big question, and I know everybody wants to ask that. What I'll do is just before Dr. Paul starts is share 2 excellent resources that, again, we're going to share with you by email. And just give me one moment to bring it up on my share screen here. The Eastern Ontario Health Unit's website, and Dr. Paul will likely reference this several times today, EOHU.ca. And you'll see here right at the top of the website, they are updating it every time there's a news bulletin or an update or what's going on. The Health Unit is giving all their updated information right at the top of their website. We'll send you that link, but it's a great resource to use. The other one in regards to the questions about when my business can open, I think the answer is as soon as possible. I know Jim gets that message Premier Ford has said that loud and clear, that they want to open them as soon as it's safely and able possible. But we're going to send you this link, Reopening Ontario After COVID-19. And that's got the details if you haven't seen. You've probably heard on the news talking about phase 1 or stage 2 and stage 3. This gives you some good information about what sectors and what types of things will be coming in each phase. So being respectful of everybody's time, we didn't want to go through 45 minutes of individual businesses. We want to get everybody opened up. I know the province does at that level, but we'll send you this link to take a look at that staggered approach and that stage approach to see where you may fall into that. Today, what we're hoping is Dr. Paul can cover is, again, some best practices and tips if you're retail, if you're office, whatever it may be, and then we'll get to your questions. So without further ado, Dr. Paul, thank you, and take it away.
Thank you. I'm just going to share my screen with everybody. Thank you very much. I'm just going to give you a bit of an overview before I start specifically about some of the precautions you can take to ensure that your business can open in a timely manner. Just want to give you a bit of an overview of where we are and how we're going to be getting to sort of seeing some of the issues that we're going to be counting on. For example, when we go to stage 1, we're not there yet, and likely not until next week. Stage 1 just means that's going to be the beginning of a more robust reopening of things, which will mean more people can gather together. It's not going to go from 5 to 100. It's going to go for likely 5 to 10. And then opening up a lot of outdoor amenities, a lot of outdoor businesses, seasonal, those type of things are going to start going there, opening up some more retailers and so on. But what we'll be looking for is going to be looking at numbers, and always keep in mind that we want to be prudent, because we don't want you to open one day and then we're getting a surge of illness the next week and we have to close again. That's what we don't want to do. That we want to be able to do it in a slow, progressive way. So in terms of the numbers, what we'll be looking at stuff like this locally and provincially. So you know that in our area we have 132 cases. The good news is that most of it is not in communities right now. Our curve is kind of flattened off now, and the big jump that we've had over the last 2 weeks or so has been exclusively and tragically from long-term care facilities. So we have to balance that. Yes, it's not in the community, but it is in the community. It's getting into the long-term care facilities. So we got to balance those two. But having said that, once we start, getting a decrease, and as of this morning, Ontario had 21,000 cases, and there's a small increase every day. And what we're counting on is that a progressive pattern of that decrease on a daily basis becoming smaller and smaller. So it used to be, 600, 700 new cases. Now it's down to 300 new cases. We want to see the downward trend. We've also had 1,765 deaths in Ontario, and most of them, about 1,400 of them, are long-term care. Again, tragic. So we need to keep all those things in mind. So we need to make sure that as we open up, we keep an eye on the numbers, keep an eye on our hospitals, keep an eye on how much they're overburdened or not, and then look at the level of disease in the area. And that's why we're counting on everybody to ensure that, although I would like nothing more than to start businesses as soon as possible, but start them in a way that we have the guidelines and the procedures in place, so that we will prevent and mitigate any further increase. Now, we're going to get the odd sporadic case. We're realistic, so we will be getting cases, but the goal of public health will be to ensure that we identify where it came from, what the contacts were, so we can contain it. That's what we'll be doing moving forward. So having said that, we have a whole set of guidelines that initially I had put as orders out, but I think we put them out as guidelines right now that are really for retailers providing access to a place of business, including where members of public are served. So in other words, any type of retailer. Initially, we had this for retailers that were allowed to open. So it was the grocery stores, the pharmacies, those type of things. But now, because the way that, now we're going to be slowly opening up more now. Hardware stores are open, garden centers are open, nurseries are open, safety stores are open, those type of things. And more as businesses open, we have a whole list here. And by the way, we're going to create a small little video on this, so it could be handy as a handy guide for everybody. So, and what we're doing, and this is important. I talked about this with Eric before, if applicable, like for example, if it's a huge store, if you have a huge store, if you're a Walmart or a Loblaws or whatever, a big store like that, yes, you're going to need somebody to control your traffic, obviously. If you're a small store that you have a couple of people coming in at a time, it's not reasonable for us to impose that, right? Or to request that. So ensuring crowd control is very important, because you have to understand that we're still going to be maintaining social distancing. We still need that 2 meter kind of distance apart. We are going to be recommending, and it's not official yet, but we are going to be recommending that where you cannot have that distance, that you wear masks. That's going to be something that's going to be coming out in a formal way. But at this point, again, it's really important. Again, where applicable, monitoring your parking lot. These things all make sense in terms of crowd control. Crowd control, keeping in mind that you need to have the distancing. That's very important. So that's one aspect of it. The other one, obviously, is to implement hygiene and disinfectant procedures. So ensure that people, there might be a physical barrier in the cash. You have to provide hand washing stations, both for clients and for your staff. And again, the degree with which this occurs depends on the context of the business. If a store has a lot of walk-in and a lot of people touching handles and stuff, you'd have to go and disinfect things, with a bleach or whatever, more frequently than if you had a couple of people walking in, or if your business was mostly curbside, for example, or people just coming in, picking up and leaving. Again, it depends on the context. So we're trying to be as general as possible to be able to capture all elements of a business. Secondarily, the other important thing is screen and train your employees. And it's important as employers that you screen each individual every day. On our website, we have a list of symptoms you should be looking for. And obviously, if they're sick, they should be sent home. They shouldn't come in sick. And that's for your protection and everybody else's protection. And obviously, make sure that your staff is well trained in terms of washing their hands, how they handle money, requiring to use gloves. And all that is important in terms of training. And then there's a whole slew of other measures you can do. There's posters that you can put up. Making sure that there are things that, can't be touched or anything like that. Just look around and be logical about it. So, and then we have a whole slew of resources. And by the way, the ministry as well has industry specific sort of occupational health and guidelines as well that complement ours and follow occupational health and safety and so on. But we have a whole list of things here that you could need in terms of testing, in terms of some sector specific guidelines, depending on what you're doing. So that's for one type of business. That's going to be when we open a retail, let's say. Now, it also depends in terms of the inside protection. If you're selling goods that people just, go pick up themselves, go to the cash, that's a different thing than if you're doing a haircut, giving a haircut. And again, it depends on the context. And again, we will have specific guidelines for those specific ones as they open up. Then we also have, because again, a lot already, most of the businesses can at this point provide curbside pickup now. And so for that, we already, again, had some already delivering curbside before. So we had those guidance documents for them, but then we've generalized them so it could be, again, specific for if you want to open up and provide a curbside pickup, how we would recommend it. So again, it has to do with crowd control. Again, depending on and this applies to stores or retail businesses that have a street entrance. This does not apply to malls yet. Malls are still closed. So at this point, it's, again, where applicable, crowd control, a customer should stay in the car. You could stagger the people entering. There's a whole slew of things that you can do just to control that traffic and the crowd control. And, we would encourage online, non-cash transactions. But if there has to be a transaction, make sure that you're protected. You can either wear gloves by taking the money, or somebody could put the cash on a windshield. And there's a whole slew of things that you can do to be able to minimize that. And whoever handles the money and is not wearing gloves should be washing their hands with sanitizer afterwards, just in case, because we know that the virus can stay on paper, not for very long, but it can. And so just to be precautions. And then again, the same thing in terms of implementing disinfectant procedures. And again, this would be different in your context, in a context of a curbside, as compared to people entering your premise. Because in this situation, at this point, they're not allowing people to enter the premise, other than staff, obviously. It's just people working. It's just the employees. But again, physical distancing, list of disinfectants, and so on. And the screening and the training is kind of the same as well. Again, and all the resources is there. Again, you're training staff, if they handle money, how to wash their hands, if they need to use gloves, you know, all these precautions that are there. And then finally, what we've also done is we also recognize now that for example, for restaurants and coffee shops, there could be drive-throughs. So we also have another community one for food takeout premises and drive-throughs, where again, we have recommendations for, actually this is for food, for recommendations for food premises themselves, handling it. We've had that there for a while, but there's another one on drive-throughs, which I couldn't find here. Business, oh, here it is. We have both. So this is, again, drive-through. Again, ensuring crowd control. We've had some complaints about people driving through, picking up a coffee, and then 10 cars congregate in the parking lot and start getting out and drinking together. We're discouraging that at this point, because we don't want people to gather. The whole purpose of driving through is you pick up and leave. But that's the type of thing. So if applicable, again, depending on the size and type and context of your business, you need to ensure that the flow of customers is there. Physical distancing should be promoted, and congregating should be discouraged. We would recommend, obviously, in drive-throughs, for everybody's safety anyway, they need to stay in their car. And again, talking about the similar hygiene, disinfectant procedures, preferring card transactions over cash, if possible, and perhaps using intercom, a whole slew of things that could be done. Because again, I want to repeat, although we are going to be loosening up some of the restrictions, they'll be progressive, obviously, but they're also going to be contingent on retailers and business operators to be able to maintain these precautions, the social distancing, hygiene, and so on, all throughout the process of reopening, which will take months. We're not talking overnight. It'll take a couple of months before we kind of have a semblance of normal. And so that's really what I just wanted to go over. And Eric, like I said before, we are going to be creating, little all kinds of handy little tip sheets and little videos, just to get people going in terms of just have an idea. So if you haven't opened your business yet and you fall into one of those categories, you can at least get an idea and you can anticipate what to do to be ready. Tomorrow, the Premier is going to be likely announcing, we'll be announcing some small steps in terms of opening. My suspicion is that the stage 1 that I talked about is not going to kick in until next week. Again, we're looking at those, but we're close. So if you ask me, can I open my business? If your business can provide, if you're not in any of these essential categories right now, but if your business sells and you have a street entrance, you can open your business. If it's, again, there are certain businesses that are law practice and so on that are allowed to open anyway. So others, I have one for personal service settings, yes, and that's a challenge, because that one is going to be really based on how can we mitigate it. Obviously, in a personal service settings, like getting a haircut, getting your hair done in a hairdresser, a salon, and so on, you cannot have distancing. So there you're going to need masks and other precautions as well. So, and in general, what we're going to be recommending is, under any circumstance, under any business, that people should be masking or having a face protection where they cannot implement the physical distancing. So, Eric or Jim, that's all I have to say for now. I'll take some questions. Like I said, I can't answer industry specific ones because I'm not sure, but if there's a general ability right now for people who can sell by curbside to open, there's no restriction at that point.
Thanks, Dr. Paul. And a couple of things, we have some comments coming in the group chat, which is great. And I know Adrian might have some other ones. But let's have Adrian give the reminder again. If you wanted to ask a question, how to do so, Adrian. We'll just get you to give that reminder.
Yeah, absolutely. So if you are, as opposed to using the chat feature, as we mentioned before, just use the under your participants tab, click on raise your hand so that we know you'd like to ask the question, and you can ask the question directly to Eric, Jim, or Dr. Paul. For those of you calling in on the phone, that's *9 to raise your hand.
So I had a couple of questions, Dr. Paul, that I just wrote down. Maybe I can cheat and take advantage and go first with a couple of them.
Sure.
You had a great conversation with our municipalities this morning. This is the second or third time Dr. Paul and I talked today, and Jim, but with our municipal partners, they're having conversations about reopening their township offices and what that would look like. Can you go through again, maybe some best practices for office space?
Yeah.
Or for example, it may be a law firm, an accountant, a township, how that would work.
So for those, again, you know, the general measures are making sure that you have enough space to be able to have the number of people in there that physically distance. That's one thing. So you can, it's one thing to have 5 people in a room, you know, that fits 20 people versus 5 people in a room that fits 4 people, you know, that type of thing. So that's number one. Number two, you can control entry at the door. You don't have to have somebody at the door, but you could have mechanisms where you could have somebody ring the doorbell, bring them in one at a time, assess them, ask them if they're sick, you know, not to come in, those type of things. And then finally, one of the things that we'll be talking about, and that's what I was on the phone with the Chief Medical Officer of Health before, is going to be a process where we'll be recommending kind of what's called a cohorting. You know, putting like 5 people at a time just together and not intermixing with others. So you'll have one department working together, you know, social distancing with each other or even closer, but they will not intermingle with 5 others in another department or another area. Again, it depends on the context, but that's forthcoming. That's going to be some guidelines that is going to be forthcoming. But you kind of get the idea of like, the reason we're doing that is, let's say you have an office of 40 people. If you put 40 people together and always together and one person gets sick, then we got to trace 39 people. If you have 8 groups of 5, and those groups, again, depending on the context, and those groups of 5, one person gets sick but hasn't contacted the other 35, then you're only looking at 5 people that you're going to have to, you know, make sure the contact and you're controlling the tracing. So those are the type of things that we're looking at. And again, we're not recommending that somebody be at the door, you know, but there should be a mechanism where you can control, at least understand who's coming in, and ensure that you have signs on the door. And there's all kinds of signs that will be available to download, you know, to say, you know, if you're sick, don't come in, those type of things. And the same thing for your employees. But there are going to be ways that we can, recognizing that you're going to have to be, you know, closer, but we might put like 5 people together in a group that doesn't mix with others. And if you have to have meetings, you can have them, you know, through video conferencing or through telephone, those type of things. So again, these are very, very early on ideas that we've been having at the ministry level, but those are the type of things that you can be doing. And we're actually looking at doing that for schools, summer camps, and those type of things, where if we start putting people together, you'll have them in small groups. So you won't have 100 people to worry about. You'll have maybe that smaller group that had more closer contact.
And one of the other comments that came this morning actually afterwards was about lunchrooms. So for an example, it's one thing to have separate desk space. I know people are rearranging desks to give physical distancing, again, working in groups, again, only seeing 4 or 5 people by department, those types of things. Lunchrooms as well, of where maybe splitting a lunchroom, we're having a couple of fridges, a couple of microwaves, so there's different spots if you're a larger office. Yeah. And one of the other ones I thought was interesting was picnic tables, where they, you know, you don't want everybody sitting at a kitchen table in the lunchroom. We're having a couple picnic tables outside where one person can sit and the other one can be 6 feet away at another picnic table. It still allows you a social dynamic at lunch.
That's right. I mean, one thing we don't want is, like, we have, like, at our health unit, we have a big lunchroom. It fits 25, 30 people. I don't want that to happen at once, type of thing. You know, our staff now, a lot of them are working at home, but when they come back, we don't want them to congregate. So either you eat at your desk or eat outside, or you stagger the lunches so it'll be manageable within the square footage that you have to be able to safely distance people from each other.
Good. And another comment, just one of the things I'll say in here as well is one of the questions that came in the group chat was, As certain stages or phases are opened up, we'll offer this with Dr. Paul again as need be. So right now, this is focusing on stage 1, starting to get you thinking about glass protection, for example. If you have a front desk, putting plexiglass up, those types of things, and start to get that, because I know right now there's a back order on a lot of those products. So start to get those things ready and what you would need. But as we get into the personal services industry, as we get into other stages and phases, we will do this. And as Dr. Paul's just showed, as you have the food takeout and the drive-through, there are those pages, there are those guidelines, and we'll certainly host more of these for our constituents as need be, and have a chance to ask Dr. Paul when we get a better timeline of when the next phase may be on that.
Yeah,
so,
and Eric, one of the things that I wanted to mention as well is, talking about food premises, right now they're only selling to delivery or takeout. At some point there's going to be an opening of restaurants as well, dine-in, in terms of dine-in. But again, that's going to look different. It's not going to be, I don't know if you've seen on television, some of them have booth separators and those type of things. And as we start to open those up, we're going to have more specific guidelines to be able to share with the restaurant owners. I'm Greek, so my family is from, restaurants. So I'm very sensitive to that, so I know that, I don't know if we have any restaurant owners here, but I get that question a lot. There you go. I get that question a lot. Right. So, and even like, I know we had a question about personal service settings, barbershops and so on as well. There are certain types of interactions and certain types of businesses that, will call for more specific guidelines and specific things. So as we approach to opening them, we're going to have, some documentation and other tips or other more like focused recommendations as we start opening them up.
Wonderful. Next question, Dr. Paul had written down, is on enforcement. And this is where very often outside of pandemic, you and I usually talk, and I know Jim's the same way on different things, but very often is enforcement. I just want everybody's on the call to talk about what the health unit's approach to enforcement is. As these new rules come in, your efforts to communicate them and work with the business, that they're not meeting a standard depending on the situation. Can you just talk about your approach to that to give people some...
Well, I've been sharply criticized by the media that we're not fining people, and I'm okay with that. I think one of the premises that we've always had, in enforcement for food premises, for anything else that we enforce, I always want my inspectors and enforcement officers to work with the operators to address issues, and suggest ways of bypassing them and so on. We haven't issued many fines, through the pandemic. People are stressed enough, and my policy is not to come out with a fine right away. Our policy is to educate and get compliance that way, or sometimes understand why a person isn't compliant. Sometimes they say, well, I can't do this because, okay, then we'll figure out a workaround. I'd rather figure out a workaround rather than fine people. So there's not that many businesses that we find. I think there's maybe a handful, and those that because we keep going back for the same thing. That's a different issue. But my approach will be moving forward, and particularly I'm sensitive to the very fragile situation that a lot of the businesses have been left with. The last thing I want to do is come out there and start fining people. We want to be able to help you, and that's why I'm taking a lot of time, and I welcome Eric inviting me here, so we can maybe get people off quick and in the right direction in terms of the infection control procedures. And like I said, we do get complaints and we follow them up. And in many situations, it's a misunderstanding or it's an inability to comply with something because of it doesn't apply to that particular context. So although, we would like everybody to be compliant, that compliance may vary from context to context. So it doesn't mean that if somebody's doing something differently here and there, that we necessarily have to go and find that person. And I'm getting criticized in the media for that, but I don't care. I don't care. I don't want to. That's not the way that we've working with our enforcement officers. We're asking them to look at education, work with the businesses that we're trying to overseeing, because our goal is to, at the end of the day, promote business, but also promote health and wellness, and you do both.
My last question, then I'll pass it over to Adrian to go through the ones that have asked. And actually, Terry Tinkus, I see, asked this in the sidebar Zoom chat. What's the responsibility of business owners for the area outside as people are waiting to go into a store? You mentioned about, if applicable, to have somebody at the door. But what about if you have two people in the store at one time? What's the responsibility do you have to make sure people are social distancing outside waiting in line? Do you have to tape up those types of things?
As far as I'm concerned, and I'm not a lawyer, but if they're waiting to come into your premise, it's your responsibility.
So some of the best practices would be perhaps putting tape out on the sidewalk, on those types of things. Any other suggestions of signage?
Signage. Look, I understand, and there are a lot of stores where the signage is there and people are not compliant. We're not going to go and fine people for that. We might go and try to help enforce it in terms of, we're going to do public messaging as well. But it's like if the cars are there for your facility, it's your responsibility to at least ensure or make an effort and people should understand that they shouldn't congregate, more than 5. On the other hand, it's hard. I know it's hard, but we're hoping that people can be compliant. And I'm talking about the customers, not the businesses.
Yeah. And lastly, before I pass it over, I see Nancy Struthers has asked about marinas being allowed to open for boat launches. I'll look at Jim and Dr. Paul, and the Premier has promised a positive good news announcement
Stay tuned
at 1 p.m.
I'll let Jim handle that one. I know the answer, but let Jim handle it.
Well, I mean, it's a stepped approach, and I know we've heard rumors that there'll be people will be happy around the long weekend coming up in May, even though they're not necessarily a holiday like we usually have. But tomorrow we'll find out.
There'll be an announcement tomorrow at 1.
Yeah.
So stay tuned for that. And again, I'll just say before I pass it over to some about healthcare businesses, massage therapy, chiropractic, and physiotherapy. They are in a later stage or phase. They are not included in stage 1.
No, they're not included in stage 1.
And we will send you the document to kind of show what those timelines are. And again, we don't have an exact answer. And I will just say to that point, as Dr. Paul, I know Jim have said and the Premier have said, when they get stage 1, they're monitoring for a couple of weeks. That could be 2 weeks, 3 weeks, or 4 weeks. It depends on, as that phase goes, how the public is reacting, what numbers are looking like. Yep. But I will, again, send you that document that talks about the stages and phases and how they might be able to do that. So,
but Eric, for healthcare professionals, be it, any primary care practitioner, like a primary care type of setting, be it a massage, chiropractic, physio, there are some guidelines right now that allow them to function, in an emergency setting type of thing. And there are available on the website. I can send you that link so those that at least can get an idea of what that is. And I was just on the phone again on that one because there's going to be some modifications on it. Basically, if somebody's sick, you don't service them. But there are going to be some more guidance documents for that primary care type of setting as we start to open those up, because some might open, like dentists for emergencies, those type of things might open earlier.
Perfect. And now I will pass it over to Adrian, and I will wrap up and likely say goodbye. I have a parliamentary committee at 3 o'clock, and I've got to log in about 1:45 for my sound test. But Adrian, Jim, and Dr. Paul can continue this. And I just thank everybody for joining us today. We will continue these. We will keep in touch. And I thank everybody for joining us. Over to Adrian.
All right. Well, I know we've said that we're not going to focus on too much what businesses are going to be open, because again, most of the questions is my specific business going to open, and we really just can't answer that at this point. However, there is one question that kind of encompasses a few others, and that has to do with daycare. As we are starting to see more retail move back in, and people are thankfully going back to work, they're wondering what they're able to do with their children, and if private small daycares will be allowed to operate. Okay,
first of all, private daycares with 6 or less are allowed to operate. So I don't think people are aware of that, but they are. So I just was reading it before, it's still there. I know that we're going to open that to a bit bigger number as we open up with more businesses, but at this point, small, less than 6 private daycares can open. And I don't think that's well known. I was just reading it before in the list here. But recognizing that as we do open and move forward, there'll be less restrictions, like maybe I have 10 kids. So I know that less than 6 may not be palatable for somebody, but in terms of a business, but as we open up, the daycares will open up as well. And just between me and you, we're also looking at summer camps, day camps.
Perfect. We have a question from the audience right now. Barry Castleman. Barry, I've unmuted you here. Go ahead.
Yes, this is for Dr. Paul.
Yeah.
I'm a little concerned with the enforcement approach. Obviously, you can only enforce what you can actually manage, but if people know that even with extreme cases that nothing will be done, I have a concern with that, because some people just will not follow the rules.
Well, we will take action if it's extreme. That's what I didn't mean to say we're not going to take action, but it's not going to be our knee-jerk reflex is what I'm saying, the first step. That's what I meant, Barry. Okay.
Just one other quick question regarding provincial going to another province. Is that in stage 1?
Not sure. I'm not sure about that. I doubt it.
That's not restricted now. It is from some of the other provinces' point of view, but we haven't been enforcing that. We're asking people to stay home, but it is a recommendation.
Yeah, the recommendation is to really stay home. So that infers that, right? And right now, the whole debate is about going to your cottage. Yeah. And the recommendation is not to. There's no order, however. But if you are, you should go. Just stay there. Don't there's some guidelines that'll be out there.
Yeah, as far as the cottage goes, they're recommending you take your supplies with you, so you're not.
Go there.
There's only so much you can stop people, because they are paying taxes. They own a place.
Yeah, I think it's a good compromise.
Okay. Again, if anyone has a question, just use the participant tab to raise your hand. A question came in via email, Dr. Paul, about businesses as they're reopening. Is there recommended suppliers where they'll be able to get the personal protective equipment necessary for themselves and their staff?
I have to tell you, we're looking at that. We don't want staff to be using medical masks. So there's a whole plan right now as to seeing what else we can get for non-medical purposes, because the medical masks, we're having shortages to begin with our staff and hospital staff. And so we're just about to rev up a protocol for masks, because that would be the only thing you'd need at this point. Again, depending on what you're doing, but in most cases, it'll be just masking that's required. And again, we're just about to come out with a recommendation on masking. And I'm not sure if the Premier is going to release that tomorrow, but essentially it's going to be where you can't social distance, you mask. And I'm talking face coverings. That's why I'm not face coverings, not specific medical masks.
Okay. Another question that came in was regarding what the responsibilities of the employers are if an employee now moving forward does feel ill and then has to leave. Do they need to be quarantining themselves for 14 days again? Should they be tested? If they come back negative, are they allowed to come back to work? Even if they're just
those are the first thing is that if it's your responsibility to send that individual home, or don't allow the person to come to work if you know he's sick or she's sick. That's the first thing. If it depends on the context and it depends on what's going on. Right now, if that individual, if you're working as an essential service, we can test that individual. As of Friday, and again, I'm not, we'll be testing everybody. So there will be testing available for symptomatic individuals. And so once the symptoms, so let's say somebody tests and they're negative, in 24 hours, if they're fine, they can go back to work. And those are protocols that we have in place. But the bottom line is that if somebody's sick, either and you find out at work, that individual has to go home, or if you find out before he or she comes to work, they don't come to work. And if right now, you'll see there'll be testing available more broadly for those situations. It'll open up to anybody.
Okay, that's actually one of the follow-up, just an update on the testing. We had a couple of people saying, will testing be available across the board, and what's the status?
Yeah, very soon there'll be some announcements shortly, but that's what we're planning for.
Is that testing with symptoms or testing regardless?
No. When I say testing, I mean testing with symptoms. We're not going to do asymptomatic because that's a whole different issue. If an individual has symptoms and there's a whole list of them, then we'll test them. And if the test is negative, great. If the test is positive, obviously that individual has to isolate for 14 days. And then depending on what that individual's job is, if that individual is working in healthcare, we need to do 2 tests 24-hour apart to send that person back to the hospital, wherever he or she is working. But for people in a non-healthcare setting, after 14 days and they're fine, there's no retest required.
Okay. I'm getting a lot of questions coming in, specifically preparing again the front of their offices, be it dental. I've got a couple here with respects to plexiglass. Is that something they should be doing now?
They should be doing it now. That plexiglass will be the norm until further notice.
Okay. Jim, a couple of questions again about the Quebec border specifically, if there is going to be a plan in place for that, or if it's, as you mentioned before, I know you said Ontario really doesn't have any restrictions as far as cross-border, but for Quebecers coming into the province.
Well, I know at this time is whether that's a good use of our officers. I've done a couple of surveys around, and we're talking less than 2% of the cars are from Quebec. So, and some of those Quebec cars are actually working here. I know our hospitals, there's quite a few Quebec doctors. So I would say normally you would expect quite a few more Quebec travelers, just of the people that worked here. So I don't see it as a problem. I know it's I think a lot of cases, unless you're in the Hawkesbury area, I think that's a little different because they're a bit of a hub for that area crossing Quebec. But in our areas, I've gone out and I haven't seen the cars. This weren't an issue. And remembering also, as you go close to the border, there's the people in the houses and the St. Helens Forest where really the local place to shop is in Ontario, because they're some distance from a local place in Quebec. But overall, I think our region's been known to be shopping more in Quebec than vice versa.
Okay. Dr. Paul, questions about handling cash as businesses are reopening again, and for those that don't have debit or credit, are there best practices involved?
Yes, there are. We have them on those guidelines. We do have them, but they're essentially either you can wear gloves or you need to have distancing when you're accepting the cash, and then just wash your hands after you're touching the cash. That's really it. It's very rare that you're going to get transmission of virus on paper money, but we don't want to take a chance. So what we're saying is for individuals who handle the cash to sanitize their hands each time they handle cash.
Thank you. Another question from the crowd here. Debbie Burns. Go ahead, Debbie.
Hi, thank you. Actually, first off, thank you for actually hosting these events. So my question is specifically to Dr. Paul. I own a small coffee shop in a medical building, and it's in regards to the barrier. I have seen some things as slight as having a clear shower curtain up in a store. What I'm looking at is actually refurbishing an antique window to have as the barrier. Is that okay, or does it have to be?
That's fine. That's fine. We're not, as long as it's a physical barrier. I mean, even you could put a curtain, really, but you can't see through it. Like as a customer service, right? No, anything that will just block you, that will protect, like, because you're obviously going to be closer than 2 meters, right, when you're interacting with a client. So, a plexiglass, a glass, anything. I mean, and like I said, even a curtain, but you can't see through it, right? So, that's fine.
But I currently
polyethylene.
Me?
A clear polyethylene would do it.
Yeah, something that's clear. Yeah, we at our health unit, we couldn't get the glass right away, so we put just like a plexiglass temporarily. It's fine.
Okay, perfect. Thank you.
No problem.
A question just came in, Dr. Paul, via email. Yeah. Again, with respect to testing, but it's testing for the antibodies to see how many people may have had the virus and been asymptomatic. So after
that's a good question. Today, Health Canada just approved one test called Liaison, I think it is. I just got the press release now. Apparently, they want to test 1 million people. I don't know how they're going to do it. I just got it now. So stay tuned. There's going to be likely some kind of random sampling. They want to do a couple of million people of what I'm seeing here to be able to test. Now, one of the things that we don't understand is most situations, if you have a virus, let's say you had chicken pox as a kid, I can test you now, and I know they have antibodies, and we know that those antibodies are protective. So the question is, yes, we could do the test. That'll tell us if you've had the infection, but it doesn't tell us if they're still protective because it's such a new virus. But the test is available. We just got it today. I mean, approval by Health Canada. So there will be that kind of a random approach to seeing what if people, like I said, it'll tell us two things. One, it'll tell us if you've been infected. It may or may not tell us if you're protected moving forward. That's what we're not sure about.
Thank you. Okay, we have another question from the floor. Barbara Leduc. Barbara, go ahead.
Hi, can you hear me?
Yeah.
Again.
Thank you for taking my question, and thank you for doing this. So if we have a family member who is sick, who is not at that place of employment, does it mean that all people living within that household need to stay home until they find out what's going on, or, assuming that maybe they have COVID, maybe they don't, we at this particular point in time?
Presuming they are not working in healthcare, they could just monitor their symptoms and then take it from there. If they all get sick, then we can test them. But in the point where they're not healthcare providers, they can just write it out, not go out. But the individuals that are living with an individual index patient, we'll call it, could just self-monitor.
So they can still go to work at this particular point?
Unless they get symptoms.
Right. Okay. Thank you for answering that.
Okay, well, we're coming up to 3 o'clock here. I don't have any other questions coming in via email. Jim and Dr. Paul, would you like to say some final comments?
Yeah, I'd just like to say, like I said, we've been very lucky in our area. Again, aside from the tragedy in Prescott Russell, where we have a home that's got at least 9 deaths. And again, those are individuals who are very old, fragile, and a lot of them were palliative anyway, but that's still a tragedy. But overall, we've done well in our area. We flattened the curve, but I'm not going to jump up and down because we were fine in Cornwall, and a couple of days ago we had a case. So we need to be still vigilant about it. We need to be careful, and we need to be carefully going back to normal. That's going to take us a while, but the more careful we are, and the more, every time we take a step forward and we see it's good, we go more forward. One thing we don't want to do is go backwards. So and studies have shown that if you do it in a slow, progressive way, at the end of the day, it's much better for the economy in the long run than if you have to keep going back. So I just want to tell people that and thank everybody for their cooperation because we flattened the curve.
Thank you, Dr. Paul. We have one question came in right at the end here, so we'll it's Rory McClellan, and I'm sure, Rory, you want to know if we're going to be able to tee off this weekend?
No, I'm going to save him. I'm going to save asking that question. I'll wait like everybody else till 1 o'clock tomorrow. But what I did want to thank you, Dr. Paul and Jim and Eric and everyone involved. Are we required to ask our customers if they've been sick, if they've been in touch with anybody with the virus, that sort of thing?
I think you're required to ask them if they're sick. I don't think you have the right to, because you have to, if they're sick, you have the right to refuse them, or you have the right to ask that, because you're protecting others.
I see. So it would be in our best interest.
It would be in your best interest to screen even clients.
Well
if
enough
sick,
to play golf.
don't come in, that type of thing. Okay.
That's the only question we have to ask.
Okay.
If you're sick.
Yeah, at this point, yes.
Perfect. Thank you.
Okay, Andrea, and I have to go. I got another call in 2 minutes.
Thank you, Dr. Paul.
Bye-bye.
Jim.
I just want to thank Dr. Paul for joining us today, and we are providing feedback through our command table all the time about businesses. Certainly a lot of questions going back, and we've been able to resolve many of them. But going forward, as we enter into phase 1, 2, we will be actually holding sessions at that point, just to answer questions and to get feedback of what some of the issues are. So anyway, these business sessions have been very helpful. We pick up a lot of concerns and questions, and they are many of the same questions we hear right across the province. So I want to thank everybody for their cooperation. I know Dr. Paul talked about some of our most vulnerable, and certainly this disease is very tough on people that have immune compromises or are elderly. You know, up to 25% of the people over 80 are passing away. So anyway, thanks again, and thanks Adrian for moderating today.
No problem. Thanks everyone for joining. I will be sending an email later this afternoon with the links that Eric and Jim and Dr. Paul talked about. So you'll have those all at your disposal, and also information for any upcoming seminars that we will be doing. So expect to see that, and you will be able to watch us again later on YouTube or Facebook, so you can share with those that weren't able to join us. So thank you everybody, and have a great day.
Thank you.